Viewers around the world, once more I greet you all. I'm Dr. Mofor of the Clinic of Phytotherapy, Ayaba Street, Bamenda, Cameroon. I'm here today to do a presentation on the male infertility and sexual weakness in men. As regard my last video that I was talking about female infertility causes and how a woman is supposed to do to get pregnant. And so many men were like, they reach out to me asking me exactly that. What about men? Are men not having challenges? Are men not having problems? So I just told most of them. They contacted me through my message, inbox me, like asking what about men. So I told them that I will address the male situations. And today I'll be talking to the men. Before I talk about the women, and this time we're talking about the men. Causes of infertility or sexual weaknesses in male. Number one, psychological phenomenon. Psychology. Most men are stressed up. 70% of sexual weaknesses is as a result of psychological phenomenon because of stress. A lot of stress contributes a lot to poor sexual drive and sexual weaknesses or low sperm count, premature ejaculations. Number two, alcohol. Excessive alcohol will lead to sexual weaknesses and loss of sexual desire. Sometimes some men don't like both, like they need to take a lot of alcohol. If I don't take alcohol, I'm not able to go about 1 round, 2 round, 3 round of sexual intercourses. Definitely just killing off and fooling off yourself, because those things, they just play a lot with psychology. It is not the alcohol, it is not the drug, over drugs like marijuana, hard drinks, hard whiskey. Those things, they lead up to sexual weaknesses and loss of sexual anxiety as well, can equally lead to infertility. Another one is internal hemorrhoid, what we commonly call PAR. Internal or external PAR, that's the situations where you go to stool, you have itches in your anus, you have grumbling stomach, you find the rectum shooting out after stool, you find bleeding, or you find constipation, grumbling stomach, and general body weakness, waist pain, sexual weakness, and those things. Internal or external PAR can lead to men sexual weaknesses and poor sexual drive. Number three, another one is the venereal infections. Venereal infection, we talk about venereal infection, we talk about chlamydia, we talk about syphilis, we talk about gonorrhea, we talk about staphylococcus infections, especially staphylococcus, that each and every one of us, we know. We all have positive cocci, but sometimes it becomes reactive. And when it's reactive, what does it do? It feeds on the sperm cells. And unlike other bacteria that equally feed on the sperm cells. I will tell you something. One time ejaculation in the man, you ejaculate more than above 100 million to 200 million sperm cells. And with this, when you have a bacterial infections or something, some chronic infections poorly treated, they live on those sperm cells. They damage those sperm cells. So at one point, you can have like kind of 10% dead cells or 20% dead cells in your sperm. This is why you need to consult. You need to consult to check sometimes with those kind of poor situations, because when you have dead cells and as well as some cells that are stuck that cannot move, because sperms is like it's split up. There are many multiple different cells that runs in terms of the male reproductive system as far as you want to when you ejaculate once. So now some of these sperms, when you have chronic infections poorly treated, they feed and they damage the sperm cells, and the sperms become sterile. They become blocked in such a way that they don't move freely, and some paralyzed, some you have more dead cells. This is why you go on a woman, within the first 1 minute you discharge, or some will even go not up to 30 seconds. Some will even run just for about 1 minute or 2 minutes and they discharge. Or some will say they are very fast guys. Oh, it's just because I'm very fast. No, it's not fast. Sex is a mutual situation where you have to entertain yourself, not only keeping yourself on, but you have to equally entertain the woman. The woman needs to secrete her own fluid while you secrete your own. So definitely, some of us, this is why most cases we have more problems within our marital home and situations, because men don't really handle sexual activity so well, and this is as a result of some of these things I'm talking to you about. You have chronic infection poorly treated. You have situation that you didn't take care about. Not only that, there are men who have poor secretions of gonadotropin and testosterone. Testosterone is one of the male hormone that enable the sperm cells to be very much matured. With insufficient testosterone, it is either low or high, it is a problem. So those are things you need to check. Sometimes you are the woman for 1 year, 2 years, you are unable to impregnate the woman. The lady is not pregnant, and at one point your in-laws or your brothers, your sisters, they start accusing this lady, whereas you don't know that you yourself, you need to check yourself to know whether are you equally fine or not. You need to check your testosterone to see if it's sufficient. You need to check your gonadotropin secretions to see if it's sufficient. As well, there's erection transmitter. Erection transmitter, we're talking about the communications between the brain and the heart, because there's a communication between the brain and the heart. That when you are sexually harassed, or when you see a woman, there's a communication between the brain and the heart to enable enough blood flow within the capillaries of the penis to enable the erectile situation to be firm. But now, when you have a problem of definitely a lot of men encounter a lot of challenges, be it challenges at home, be it societal challenges, be it family, be it work, be it all natures, many situations, many factors of challenges that will lead you to in such a way that you think about some other thing else without focusing. That communication should not go, because you need a lot of pressure, of enough blood flow to be supplied within the capillaries of your penis to support your erection drive to be very much firm, without which you'll be sexually weak. So as well, like I talked, environment is one of the factors that leads to male impotency and premature ejaculations. Not only that, there are also men who are hypertensive. Of recent times, we go into a lot of things. There are a lot of challenges and a lot of situations, a lot of quarrels between our household, between you and your wife. You don't have mutual common understanding and so on. Definitely, you develop a lot of poor sexual drive. And this is why I advise women that, see, this thing is, it is not just you just come and you just need to have sex and then just make things flow. No, you need to have a mutual communication between you and your wife. It's love, it's compassion, it's understanding to develop. It's really the body need to accept. Sometimes there's a match between a man and a woman to flow, for the woman to be able to float and you float as a man, without which it doesn't really work. So not only that, there are people suffering from high blood pressure. High blood pressure is another factor that leads to poor sexual drive. Not only high blood pressure, but there is also diabetes. People suffering from diabetes leads to poor sexual drive. So this is why some of them, they take you go take some kind of maybe stimulants to stimulate the blood. That stimulant that you take always stimulates the vessels of the heart to enable blood flow to flow, which doesn't really support you in terms of sex, because when you take it, it works within that same time. After that, it drops down. These are the things that in our clinic we cross-check. We check your hormones. We check all these things. We take all these things into considerations. We have machines that we run. We check your cardiovascular. We check your hormones. We check all of those things to ensure to know exactly where the causes of your sexual weakness is coming from. So those are the things, some of the things that will make a man to be sexually weak, or for a man to be infertile, not able to impregnate a woman. This is exactly what I was saying, that it is we bring these things to you just to create awareness, to make you know exactly what it is. Whereas we tackle these things back in our clinic. Those are the vast nature of situation that we tackle. Using like the nature where we use, I'm using the background of the nature because everything it flows with nature. This is why I'm using this background. So viewers, next we'll be talking about what can a man do in order to be fertile or to have a good sexual drive. That will be our next topic. Contact me, Dr. Mofor Clinic, Ayaba Street, Bamenda, or our email is there. Our telephone number is there. You can reach me through WhatsApp or Messenger or any apps. Then we will realize so many things, and we can always deliberate to put so many things through that will help you. Thank you so much for listening to me at this time. A wonderful time as we continue to share together.